so excited that you're here, and more importantly, we're so excited that you had an opportunity to kind of understand our approach in looking at getting to the root cause of your problem. Because when you came to us asking about solutions for your knee pain, we got to really educate you about what we were going to be doing, including regenerative medicine, to get you back on track.
Yeah.
How's it been going so far?
The only thing I'm disappointed about is the fact you guys weren't around in the 80s when I was playing, because the whole concept you guys have of trying to help people and eliminate some pain.
Yeah.
And
without
I think,
the use of drugs.
Yeah, without the use of drugs. As a player or as a person, all you want is, not to be in pain.
Right.
And just do the normal things that, for me, just doing the normal things I like to do, like working out. I have a townhouse and I have 3 levels of steps right now.
Yep.
3 stories, so I have to go up and down every day. I've always done so much more than that, but right now that's just like, oh God, I gotta go back to the top. I got something at the top floor. I yell up, will you bring me that paper down? But now, hopefully with this, again, I always try to challenge myself, but with you guys' help, I think there's a lot of things, for me, which can really happen the right way. The collection of us, we're a team.
Yeah.
And I always put it like this: together, everyone achieves more. Yeah. That's what we're going to go with, the word with team.
I think that's the whole key when we think about our patients. We often don't think about as the patients either. They're part of the treatment team. If a person doesn't participate in the care, people don't get better either.
Yeah.
And that's what we really like to kind of instill upon their patient as well.
Remember when we talked and showed you your scan and your feet were kind of flattened out, and how that was affecting your knees and bringing the pressure in?
Yeah.
And we saw all the arthritis on the inside of both the knees.
Yep.
So this is going to be great because it's going to put your foot in the right position so that when you're walking, you're not going to be coming over as much.
Okay.
You will get so addicted to your
I
orthotics.
am sure.
And then you know what they make too?
They feel so good.
They make custom flip-flops and custom sandals. So like in the summertime, you just say, Tim,
Wow. You know what that is? That is so cool. I mean, and, I hate it when I used to go sometimes to get the orthotics from Dr. Scholl's.
Yeah.
Because it was so thin, I had to use maybe 2 of them.
Yeah.
To actually give you some comfort. But
And these are custom for your foot. They cover all 3 arches too, so there's all differences and everything.
This is your right knee to start. So if give you just kind of an idea. So of course the long bones and the above and below, but that space between the joint is what's getting lost. So your joint is breaking down such that we're losing some of that cartilage space. That little white area in here that is called sclerosis, that's just another indication that you're actually having some degeneration and breakdown. So we call this tri-compartment. You have breakdown on the inner side, the outer side, and the kneecap that sits way up on top. But the fact that we have some space, the fact that we have separation of your bones between the two, we actually have a lot of good help here to make you feel better.
Okay.
Getting that injection in there really can give us some effort to kind of have some healing properties. And really, we don't restore the height, we don't grow it back, but we actually might reduce some pain and actually keep your function so you can actually feel like, I got this. I can do more things because it still is moving. It's not supposed to look straight up like this, even though we think it should. There should be a nice little rounded basic, so we have lost a little bit of the normal curvature and arch of your neck because of its degeneration. If we look at the kind of the bones at the top a bit, we'll take these two. We see a white bone and a white bone in there, but yet that space, that dark area, that's a gap, that's a disc space. That's the way it's supposed to look. If we move down to the bottom, going down into the lower areas, we see that there's bone spurs down in here, and you don't have that space. You kind of lost that little narrow area. And what happens is when we lose that height, this little circle in here is where the nerve exits to come out down your arm, helps control some movement and spaces. So take a look as you get the opening here. When we get to those tight abnormal spaces, there really isn't much of a hole left.
Oh my God.
Because that's the arthritic process narrows that space. Well, let's take a look at your lower back. So again, same kind of concept. Does your lower back get stiff? Is it achy? Is it painful?
Oh yeah. It's
So-
just like it's always seemed like I should be rotating.
So we always got to try to
Or
switch it.
seem like, I think it's only getting worse because of the way I sit as a broadcaster.
As we go down to your lower back, we see that we lost the space. We're getting more narrowed in here, and really that last segment called the L5S1 level, going down to where the tailbone comes off the screen here, there isn't much straight space left in here. Look at that gap, that's really minimal. So we got some things to work on. We definitely have some ways we can make it better, and I think this is a good start. Chiropractors and their spine knowledge and the physiatrists and the spine knowledge, get the mixture of the two. That's what's going to make you better.
One thing's for sure, what we're going to really see is, as Dr. Mike was kind of reviewing your lower back x-rays and where that disc space was really, decreased. And we're going to use the table to stretch it out lengthwise.
I'm gonna love that.
You're going to love that. We're going to kind of work our way up. We'll check the mid-back to see if it's restricted. So this technique is called decompression. Got a lot of research going into it. And they actually document how much space the disc opens up at about
So
25%. Your pelvis is a little off. It's showing that your right leg's a little shorter than the left. It's not really. What we're going to do is an adjusting technique called the drop, just to move that, get that moving. No crack on this, but it just helps mobilize it. So a little pressure, it'll drop a little bit. Everything nice and balanced. So we're going to do an adjustment in the mid-back. Those joints are a little bit restricted or stuck. This is what I call the bear hug. Oh, that's what I'm talking about.
Yeah, it was so stuck.
My God.
It's stuck like Chuck.
Wow, that is just jammed.
Yeah. That's the way it feels like in the morning.
So now you can see, after Dr. Mike went over the x-rays, just everything was so compressed into that area. What we're trying to do is, the arthritis is going to definitely advance if we don't address what the problem is. Got to keep those joints moving. And now today, with the regenerative medicine for the knees, we're going to help to repair the damage from the arthritis as well.
Okay.
What Colleen's going to do, and this is going to be important with the advancement of regenerative medicine, to collect data. So one of the things that we like to do is she's going to take you through a couple of tests, knee index, to get an assessment of where you are before. And then when you come back for your PRP boost, we're going to retest it. When you come back again, when we have Colleen take it away. And
Okay, so we're gonna go in the hallway and do a brief walking test. It's just a 6-meter walk test.
Go.
Okay, when I say go, all right, go ahead. Just normal walking speed. Yep, go. Good. All the way down to the chair.
It's the most incredible thing.
Okay, hold
Actually
on.
walking.
The platform is going to tilt back, and you're going to push down with both feet into the platform, so it's kind of looking at how much force you can push through there. Okay, push as hard as you can. Hold, 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 and relax. You can do that. Move your feet side to side on the platform to try to keep this ball in the center. Okay, so kind of like you're leveling it out. All right. Just trying to keep that ball in the middle. So see your dot in the center there. Try to shift your weight to keep that in the center the best you can.
Holy. Didn't know I was coming to work out. I didn't know that.
And so it just kind of gives us the baseline, things to work on, and then the next time we do it, it'll make a comparative graph so we can see.
Your walk is slower?
Your normal 6-meter walk test was like slower than what they would say the average
That is my Denzel walk.
That was your stretch.
Sorry.
Yeah, that was your stretch.
that Cedric, the moment has arrived.
There you
We have
go.
one more
Okay,
thing to
hold on.
do, and
Here we go,
getting your
Cisco.
knees injected.
Yeah, this is the part right here.
This is the part.
It wasn't painful. It was pretty easy. Got to the point. As they say, like in the dentist's office, it was just a pinch when the needle went in. And the process seemed to be really good. I want a lot of you people to follow me because there's going to be so much more education coming on their website, my website, and we're going to get a chance really just to watch me heal and this process continue on. And eventually I'll be running again, and I'm not sure, maybe Danny Ainge, a 10-day contract, hey, might be out there, who knows. Maragal has done it. They've done it for me.
More on this, and you can check out Cedric's progress on our YouTube channel, as well as Facebook at maragalmedical.com. Talk to you soon.